session is really special because we really have an expert with us. So it makes the right sense for the name as the expert session. So actually, the Tuesday sessions that we do, we call it as the expert session. So we have really a very good expert today. So I'll just introduce Madam. Madam has already joined the meeting. So I'll just make her the panelist and then introduce her. So basically, last week, November 7th was National Cancer Awareness Day. So with regard to that particular day, so we thought of doing an activity which will increase awareness of any particular cancer. So we thought of doing something related to breast cancer. So we thought of providing this screening test for our Live 200 members. So when I was interacting with one of our advanced member, Parvati Madam, and she actually gave an idea that why don't we do a session with Dr. Poonam Patil, because she knows her. And that is how we got a connection with Madam, and she graciously agreed to do this session. So we are happy to have her. So I'll just introduce Madam and then we'll take it forward.
Very good evening to you all. Can you hear me, Dr. Ranganath?
Yes, Madam, you are audible. You can switch on your...
Yes. 1 minute, that video thing is, I am just starting that. Yes. Are you able to see me as well?
Just a second, Madam, just a second. Yes. Yes, Madam, you are visible. So
Okay.
before we start, I would like to give a small introduction about Madam. So Madam is a very experienced medical oncologist. She has more than 35 years of experience in this particular field. She has done her MBBS and MD from SMS Medical College, Jaipur. And she has done her oncology training from Kidwai Memorial Institute of Oncology, Bangalore. And she has been working since last 35 years. And she is attached to the Manipal Hospital's old airport road. And she has particular interest in gynecological and women cancer. So I think she makes the right fit for today's session, since we are talking about breast awareness, breast cancer awareness. So first of all, thank you, Madam. Thank you so much for agreeing to join with us today.
My pleasure.
Yes. So basically, I interacted with you. I am an orthopedic surgeon. Along with this, I did my, because I know, since I read that you are from SMS Jaipur, I did my MS from MAMC, Maulana Azad Medical College, Delhi. So I had many of my friends who were in SMS at that time when I was doing my PG. So I used to often visit SM Jaipur to see them. So it is good to know that you are one of that you have done your training from one of the best colleges of the country. And so we have this community called Live 200, where we basically train people on how to use lifestyle as a measure to prevent diseases, stay healthy, and in a very scientific way. That is what we do. So we have different levels of program, and every Tuesday we do a session where we talk about health related topics. That is exclusive of what we do in the program. So this week we were thinking of doing something related to breast cancer awareness, and we are extremely lucky to have you in this session. And so Madam will start a presentation, and then after that we'll take some questions with her. So if anybody has any questions, you can type your questions in the chat box. We'll take the questions later. Yes, Madam. You're all good.
So thank you very much for such a kind introduction. And let me just start the presentation. Are you able to see?
Yes, Madam. Yes.
You're able to see the screen, right?
Yeah.
Okay. So good evening, everyone. Welcome you all to today's session. And today we are, as Dr. Ranganath said, we'll talk a little bit about breast cancer. I apologize, I'm not very fluent in Kannada. I can speak little Kannada, I can understand Kannada, but I may not be very fluent. So pardon me if there is anything that is required in Kannada. I will ask Dr. Ranganath to mediate if required. So here we go. Speaking of women's health, as I said, Dr. Ranganath said that I really wish that all women take charge of their health also, as they take charge of their families and homes. Be strong, be healthy, and be in charge of not just the house, but also your own health. ಯಾಕೆ ನಾವು ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಬಗ್ಗೆ ಮಾತಾಡ್ತಾ ಇದ್ದೇನೆ ಬಿಕಾಸ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಇಸ್ ದ ಲೀಡಿಂಗ್ ಕಾಸ್ ಆಫ್ ಕ್ಯಾನ್ಸರ್ ಇನ್ ಇಂಡಿಯಾ. It is first in terms of incidence and mortality. In 1 year, almost 1,78,000 patients are diagnosed, and almost half of them die. And what is the commonest age group? 35 to 50 years of age. That is the time in life when we are most productive. But imagine at that time, if we are struck with breast cancer, something that we could have probably prevented and definitely diagnosed in an early stage. So cancer helidre, what is your best defense? The best defense is know the disease. Knowing about cancer, what you can do to prevent it, what you can do to reduce your risk, may help save your life. ಅಕಸ್ಮಾತ್ ನಮಗೆ ಅದು ಮಾಡಕ್ಕೆ ಆಗಿಲ್ಲ ಆದ್ರೆ doing what you can help to prevent cancer is your next best defense. The next key is early detection, and finding cancer early before it has spread gives you the chance to do something about it. Cancer helidre, it will come to our minds. What exactly is this cancer disease? Why is everybody talking of cancer? Why is everybody afraid of cancer? Believe me, we are all afraid of the word cancer because it is such an unpredictable disease. So we wish that we can prevent it completely, but prevention agilladre at least early diagnose madbo. So what happens in cancer? Normal cells will divide like this. You can see healthy cell giving rise to identical daughter cells. But in cancer, one gene gets mutated, and because of that, there is uncontrolled cell division and abnormal cell death. Means cell death is not occurring actually. Normally the cells become old and die. Here the cells keep dividing. And that is what causes a lump or tumor because of the abnormal mass which is formed by division. And this is what happens, that in some organ, these cells start dividing. Then slowly they creep out of that organ, get into the blood vessels which are supplying that organ. Through the blood vessels, it can go anywhere from head to toe. And somewhere in the way, the cells start leaking again out and get deposited in another organ different from where it started. So ಇದಕ್ಕೆ ಪ್ರೈಮರಿ ಕ್ಯಾನ್ಸರ್ ಹೇಳುದು, ಬ್ರೆಸ್ಟ್ ಇಂದ ಸ್ಟಾರ್ಟ್ ಆದ್ರೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಹೇಳುದು, ಬೇರೆ ಕಡೆ ಡಿಪಾಸಿಟ್ ಆದ್ರೆ ಬೋನ್ಸ್ಗೆ ಹೋದ್ರೆ secondary deposit in the bone, secondary deposit in the liver, secondary deposit in the lungs, secondary deposit in the brain ಹೇಳುದು. ಸೊ ಈ ತರ ಅಬ್ನಾರ್ಮಲ್ ಗ್ರೋತ್ ಬ್ರೆಸ್ಟ್ ನಲ್ಲಿ ಇದ್ರೆ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಹೇಳುದು. ಮತ್ತೆ cells have the capacity to spread anywhere within the body. This is how it happens. This is the normal breast structure. Breast is made by nature actually to produce milk for the newborn babies. This is the lobule, which is a factory for milk production. These are the pipes from where the milk actually is transported from this gland to the nipple. ಇದಕ್ಕೆ ಡಕ್ಟ್ ಹೇಳುದು, ಇದಕ್ಕೆ ಲಾಬ್ಯೂಲ್ ಹೇಳುದು. ಡಕ್ಟ್ ನಲ್ಲಿ ಬಂದರೆ ಡಕ್ಟಲ್ ಕ್ಯಾನ್ಸರ್ ಹೇಳುದು, ಲಾಬ್ಯೂಲ್ಗೆ ಬಂದ್ರೆ ಲಾಬ್ಯುಲರ್ ಕ್ಯಾನ್ಸರ್ ಹೇಳುದು. If you see here, if I take a cross section of this tube, you see here, this is the normal lining, and see what happens if cells are dividing uncontrollably. As long as they are inside, they don't do any harm outside. That is known as precancerous condition. But once the cells start coming out of this boundary, this is the line of control. If anything goes beyond the line of control, we call it as infiltration. You hear that even in India-Pakistan border, there are infiltration, Indo-China border infiltration. So this is what happens, that there is this line of control. In that, if there are infiltrating cells, outside bandre, ಈ ಏರಿಯಾಗೆ ಬ್ಲಡ್ ವೆಸಲ್ಸ್, ಲಿಂಫ್ಯಾಟಿಕ್ಸ್ ಎಲ್ಲ ಇರುವುದು, ಮತ್ತೆ ಸೆಲ್ಸ್ಗೆ blood vessels get entry again aatre, as I told, anywhere from head to toe, they can travel. So head to toe andre, it can go anywhere. Apart from the lymphatics, it can go to all other organs anywhere in the body. Why it is important to know? Because as age increases, the risk of development of breast cancer also increases. How much ever I will try, I will be healthy, everything. But this is the truth. These are the statistics. We all are going to get old and our risk of developing breast cancer is going to increase. That is why if I can prevent it, I must prevent it. But if I can't, I should diagnose it at an early stage. Out at 50 years of age, 1 out of 50 women will develop breast cancer. By age of 80, 1 out of 10 women will develop breast cancer in their lifetime. But good news is that death rates are declining due to increased awareness, screening, and early detection, and continually improving treatment options. ಯಾಕೆ ಬರಬಹುದು breast cancer? Who is at risk of developing breast cancer? If I look at the risk factors, ಕೆಲವು factors are modifiable. Modifiable ಅಂದ್ರೆ ನಾವು ಏನು ಮಾಡಬಹುದು ಅದ್ರ ಬಗ್ಗೆ. But unmodifiable means I can't do anything about it. ನಮಗೆ ಏನು ಮಾಡಕ್ಕೆ ಆಗಲ್ಲ. We have to live with those risk factors. What are those main things? Being a woman, increasing age. You can't do anything about it. Genes, personal history, ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ಏನು ಮಾಡಕ್ಕೆ ಆಗಲ್ಲ. ನಮ್ಗೆ ನಮ್ಮ ಪೇರೆಂಟ್ಸ್ ಎಲ್ಲ ಚೂಸ್ ಮಾಡಕ್ಕೆ ಆಗಲ್ಲ. ನಮ್ಮ ಅಜ್ಜಿ ಎಲ್ಲ ಹೂ ಹ್ಯಾಡ್ ಡಿಸೀಸ್, ಐ ಕಾಂಟ್ ಚೂಸ್ ದೆಮ್. Early menstruation, late menopause, again genetically determined what is the age of menstruation and what is the age of menopause going to be. But what we can prevent is radiation exposure, obesity, alcohol consumption, smoking, hormone replacement therapy, never being pregnant, having a first child at an older age. These are some of the modifiable risk factors. So let us talk a little bit about what breast cancer, how it can be detected early. So breast cancer screening means checking a woman's breast before there is any sign or symptom of the disease. Intent is to detect cancer as early as possible because early stage breast cancer has high cure rates. So ಏನ್ ಮಾಡಬಹುದು? Self breast examination ಅಂದ್ರೆ ನಾನೇ ನಮ್ದು ಬ್ರೆಸ್ಟ್ ಅಂತ ಚೆಕ್ ಮಾಡೋದು. Clinical breast examination, ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗ್ಬೇಕು, ಡಾಕ್ಟರ್ ಚೆಕ್ ಮಾಡ್ತಾರೆ ಬ್ರೆಸ್ಟ್. Mammogram, ultrasound, MRI, they are imaging modalities. So these three are the main tests used for screening of breast cancer. ಏನ್ ಬೆನಿಫಿಟ್ ಸಿಗುತ್ತೆ? Finding breast cancer before the symptom appears is more likely to be a smaller tumor, more likely to be an early stage, and early stage breast cancer is often curable, helpful for saving thousands of lives each year. Breast self examination ಯಾವಾಗ ಸ್ಟಾರ್ಟ್ ಮಾಡಬೇಕು? 20 ವರ್ಷ ಆದ್ಮೇಲೆ, ವಯಸ್ಸು 20 ವರ್ಷ ಆದ್ಮೇಲೆ ತಿಂಗಳಿಗೆ ಒಂದ್ಸತಿ ಬ್ರೆಸ್ಟ್ ಚೆಕ್ ಮಾಡಬೇಕು. Breast is not what the breast we see, but actually the breast tissue starts from the collarbone here till where it joins the abdomen. ಅಲ್ಲಿ ಫೋಲ್ಡ್ ಇರುತ್ತೆ, ಫೋಲ್ಡ್ ತನಕ. ಮತ್ತೆ ಇದರ ಮಿಡಲ್ ನಲ್ಲಿ ಇದು ಬ್ರೆಸ್ಟ್ ಬೋನ್ ಇದೆ, ಈ ಸೈಡ್ಗೆ ಅಂಡರ್ ಆರ್ಮ್ಸ್ ತನಕ. ಸೊ ಇದು ಫುಲ್ ಒಂದು ಇಂಪರ್ಫೆಕ್ಟ್ ಸ್ಕ್ವೇರ್ ತರ ಬರುತ್ತೆ, ಅದು ಎಲ್ಲ ಚೆಕ್ ಮಾಡಬೇಕು. ಕ್ಲಿನಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್ ಡಾಕ್ಟರ್ ಮಾಡ್ತಾರೆ. Between 20 to 40 years of age, visit a doctor at least once every 3 years. After 40 years, once in a year. But high risk situation idre, andre ತುಂಬಾ ಸ್ಟ್ರಾಂಗ್ ಫ್ಯಾಮಿಲಿ ಹಿಸ್ಟ್ರಿ ಇದ್ರೆ ಅಥವಾ ಜೆನೆಟಿಕ್ ಪ್ರಿಡಿಸ್ಪೊಸಿಷನ್ ಇದ್ರೆ ನಾವು 6 ತಿಂಗಳಿಗೆ ಒಮ್ಮೆ ಕರೆಯೋದು. ಮ್ಯಾಮೋಗ್ರಾಮ್ 40 ವರ್ಷ ಆದ್ಮೇಲೆ ವರ್ಷಕ್ಕೆ ಒಂದ್ಸತಿ ಮ್ಯಾಮೋಗ್ರಾಮ್ ಮಾಡಬೇಕು. ಮ್ಯಾಮೋಗ್ರಾಮ್ ಇಸ್ ಅನ್ ಎಕ್ಸ್ರೇ ಆಫ್ ದ ಬ್ರೆಸ್ಟ್ ಅಂಡ್ ಈ ತರ ಕಾಣೋದು. ಇದು ಬ್ರೆಸ್ಟ್ ಇಸ್ ಮೋಸ್ಟ್ ಆಫ್ ದ ಟೈಮ್ಸ್ ಫ್ಯಾಟಿ ಟಿಶ್ಯೂ. ಸೊ ಫ್ಯಾಟ್ ಹಂಗೆ ಕಾಣಿಸುತ್ತೆ, ಕಪ್ಪು ಕಲರ್, ಬಟ್ ಅದರಲ್ಲಿ ಏನಾದ್ರು ಟ್ಯೂಮರ್ ಇದ್ರೆ ಈ ತರ ವೈಟ್ ಕಲರ್ ಕಾಣಿಸೋದು. For this woman, the tumor was not felt by hand, but you can see it was a little deeper. But on doing mammogram, she was able to detect it early. Very important, breast self-examination. Breast self-examination is done by you yourself. It is done once a month in the first week after periods. And as I told you, examine the breast for this full area. It is kind of an imperfect triangle with the 4 fingers of your hand. These finger pads are the most sensitive part of the body. And with this, you can do breast self-examination either up and down or in wedges or what we call a spoke wheel pattern or in circular area. Breast should be examined in the mirror, first by inspection in various positions. Nature has made both the breasts nearly symmetrical, but one breast may be a little smaller than the other one. That is normal for you, and you know what is normal for you. But inspection and palpation. Palpation andre feel ಮಾಡಕ್ಕೆ palpation ಹೇಳುತ್ತೆ. So the best time is when you are taking a shower, when you have applied soap. It is easy to glide hands that time over the breast, and it is easy to feel a lump. But always examine even in lying position, because ಕೆಲವು ಟೈಮ್ ಕೂತ್ಕೊಳ್ಳುವಾಗ ಅಥವಾ ಸ್ಟ್ಯಾಂಡಿಂಗ್ ಪೊಸಿಷನ್ ಅಲ್ಲಿ ಎಲ್ಲ ಬ್ರೆಸ್ಟ್ ಲಂಪಿ ಕಾಣಿಸೋದು. But when you are lying down, the breast tissue is spread on the chest wall and you are able to find out lumps better. So many times, especially initially, it is difficult to realize what is normal, and regular examinations will make them aware. Any abnormality nimge kaansidre, definitely doctor the clarification koskare omme at least hogbeku. Once the doctor says that no, this lump is normal, need not worry, okay, aa tara diary nalli barbidi, ee position ge lump ide, this lump is all right, now I have to look for other lumps in that area. Pregnant and postmenopausal women, yarige periods barta illa, they should also examine breasts around the same time every month. Yake pregnancy nalli kuda breast cancer agbodu. Yen nodbeku ನೀವು examination time ge painless lump ge ನೋವು ಬರಲ್ಲ ಇನಿಷಿಯಲ್ ಸ್ಟೇಜಸ್ಗೆ. ಸೊ ತುಂಬಾ ಜನ ಅದಕ್ಕೆ ಬರಲ್ಲ, ಲಂಪ್ ಇತ್ತು ಬಟ್ ನೋವು ಇರಲಿಲ್ಲ, ನಮ್ಗೆ ಏನು ಡಿಸ್ಟರ್ಬೆನ್ಸ್ ಆಗಿಲ್ಲ, ನಮ್ಮ ಆಕ್ಟಿವಿಟೀಸ್ ನಾರ್ಮಲ್ ಇತ್ತು, ನಾನು ಚೆನ್ನಾಗಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇತ್ತು, ತೂಕ ಕಮ್ಮಿ ಆಗಿಲ್ಲ. ಬಟ್ ದಿಸ್ ಇಸ್ ಹೌ ಇನಿಷಿಯಲ್ ಸ್ಟೇಜ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್ ಪ್ರೆಸೆಂಟ್ಸ್. There may be a change in breast shape or size, swelling in armpit, nipple discharge, or rarely breast pain at a particular spot which does not go away. So generally the cancerous lump is a little hard to touch, little irregular surface, smooth tara iralla. So many times it is located in different areas of the breast, but this is the commonest area. It does not move well during self-examination. Thickening of the skin or thickening of the breast or a lump is the most common sign of breast cancer. Spontaneous blood-stained nipple discharge, change in size or shape of the breast. ಕೆಲವು ಟೈಮ್ ನಿಪ್ಪಲ್ ಹೆಂಗೆ ಔಟ್ಸೈಡ್ ಬರುತ್ತೆ, ಇದರಲ್ಲಿ ನೋಡಿ ಇನ್ವರ್ಟೆಡ್ ಆಗಿದೆ. ದಿಸ್ ಆಲ್ಸೋ ಮೇ ಬಿ ಅನ್ ಅರ್ಲಿ ಸೈನ್ ಆಫ್ ಬ್ರೆಸ್ಟ್ ಕ್ಯಾನ್ಸರ್. Change in color or appearance of the areola, that is the skin around the nipple. Rarely the skin may become red or pitting in the skin like orange peel. ಇದಕ್ಕೆ ಆರೆಂಜ್ ಪೀಲ್ ಅಪಿಯರೆನ್ಸ್ ಆಫ್ ದ ಬ್ರೆಸ್ಟ್ ಹೇಳೋದು. ಇದನ್ನು ಕ್ಯಾನ್ಸರ್ದು ಸಿಂಪ್ಟಮ್. Same inflammatory breast cancer, the skin of the breast is a little painful, little pinkish, reddish, looks a little swollen. So these things, if you see, please visit a doctor for further clarification. Clinical breast examination is done by a doctor. It helps to find a lump or change in the breast which may be missed on self-examination. Mammogram is an X-ray of the breast. It is used to look for breast cancer in women with absolutely no sign and symptom of the disease, and the lump may not even be felt but may be seen in the mammogram. As I said, mammogram is an X-ray of the breast. This is how a mammogram is done. Many women find it uncomfortable. Of course, it is a little uncomfortable, but imagine the lives that it saves. It is worth it. Once in a year only, you have to do. The mammogram is X-ray is taken in various directions, various projections, and normally both the sides of both breasts are kept parallelly in the film, side to side, so that you can compare one with the other. Both are generally symmetrical. Why we want to diagnose it early? Because early stage breast cancer has got very good survival. Stage 1, 98%. If I diagnose it in precancerous stage, it is close to 100%. But as the stage keeps increasing, means the extent of spread keeps increasing, the survival keeps reducing. Knowing that, what can you do? reduce weight, reduce obesity. Most common cause now that we see worldwide, obesity is one of a cancer creating situation. Stop smoking, very preventable cause. Avoid alcohol, again in your hands. Have a balanced diet, eat right. Tumba type of diets bandide iga in the market. We hear of keto diet, we hear of some diet, 1 meal a day, we hear of fasting and everything. But I think there is nothing that beats a well-balanced diet. Everything is important. Eat good diet with fruits, vegetables, fiber-rich carbohydrates, protein, fats. Balanced diet will never go wrong. Means other diets may suit somebody, may not suit somebody, but balanced diet will never go wrong. Be physically active. ನೀವು ಒಬ್ಬರೇ ಮಾಡಬಹುದು ಅಥವಾ ಗ್ರೂಪ್ ಆಕ್ಟಿವಿಟೀಸ್ ಮಾಡಬಹುದು. Idea is that you should be physically active regularly. Many times what people do, they will go to the gym in the morning. They will go for 1 hour. They will do lot of activities, but whole day they are couch potatoes. That also is not good. You should be walking at regular intervals. And stress reduction, have a good work-life balance, have a good sleep, stay calm, stay stress-free. It has been seen that stress also increases or worsens some of the hormones which are not good for the body and may have adverse effect. Breastfeeding is also one of the preventable ways that you can reduce the risk of breast cancer. There are many myths with breast cancer, that only women with family history are at risk. But the truth is roughly 70% of women diagnosed with breast cancer have no family history. Myth that many breast lumps are cancerous. Truth is 80% of the breast lumps are non-cancerous. Myth that breast cancer is not curable. Breast cancer is certainly curable if detected early. I showed you the stage and survival. Only women can get breast cancer. No, less than 5% of breast cancers occur in men also. Small-breasted women have less chance of getting breast cancer. There's no connection between size and risk. Breast cancer always presents as a lump. I told you the diagrams where there were many other ways that breast cancer could present. Having a risk factor means you'll definitely get the disease. No, it just increases your chance. There are many women who say annual mammogram gives radiation, so I will not do it. Yes, it is true that radiation is received by the breast, but the amount is so small by the current machines that the risks are very, very negligible compared to the huge benefit in saving a life. So last few slides, breast cancer is not preventable and even healthy people can get it. Leading a healthy lifestyle can certainly reduce the risk of developing breast cancer, but not necessarily prevent it. Hence, early detection is extremely important. So together, we can make a difference. Awareness saves lives. Know the signs. Encourage regular screening. You know what is good about breast cancer? That breast is such an external organ that you can so easily do self-examination for breast. It is such an external organ. Support each other emotionally, physically, and through shared knowledge. Early detection leads to better outcomes. So take charge of your health, do self-examination, routine checkups, and a healthy lifestyle, which does matter. In your forum, I heard that you keep talking about all these things, healthy lifestyle. Just add one chapter of breast examination and screening also, and I'm very sure that it will help you all. So let's spread hope, strength, and awareness, because every action counts. Thank you very much. Thank you, Dr. Ranga.
Yes.
I'll stop sharing my
Yes,
slides.
yes, ma'am. Yes.
Yes.
Thank you, madam. Thank you so much for a very crisp presentation. It was very much to the point. So I think all aspects related to mainly in terms of prevention of breast cancer. So when screening needs to be done. So what is the frequency of self-examination, all those things. So it was very clear. Your presentation was very clear, and we'll now take questions. I'll ask some questions before people actually can ask questions, because if you ask people, they might not be very willing. So I made a list of questions that I want to ask you. So that it benefits everyone. So that's the whole idea of asking this question. So what is the incidence of breast cancer in India as compared to the world global average? Is it the same, or we more having?
No. So what has happened is that earlier breast cancer was generally seen in elderly women. It was thought that after 50 years of age, the risk of breast cancer increases. But in India, particularly, earlier also we used to see that it was younger women who used to get breast cancer. Particularly now more so, we have started seeing breast cancer in 30s to 40 years of age group. Earlier, it was a disease of more than 50 years. Then few years back, we started seeing 40 to 50 years. Now we are seeing 30 to 40 years. So there is something probably wrong that we are doing, some price of evolution that we are paying. Our physical activities in general have come down. Like earlier in the probably in our grandmother's time, they used to get up in the morning, do all household work, walk some 1 or 2 kilometers away, get water, get all the household things, grow kitchen garden, use vegetables from there. Now we are all used to Ola and Uber coming at the doorstep. I don't even need to walk to the bus stop. Everything Swiggy will get food for me. I don't even need to get up from the house and go outside also to get something for me. Big Basket will deliver everything at your doorstep. So we have definitely changed in our lifestyle. Whatever anybody says, there's certainly a lifestyle change that has undergone over the years.
Yes, ma'am. And I was also reading about this topic. So where I found this, although India is number 3 in terms of the number of cases that we see it with regard to breast cancer, but in terms of mortality, we are at number 1. So what do you think is the reason for this?
So that is, one is lack of awareness. And second is, even if women are aware, we have seen the most educated women coming with locally advanced and metastatic disease, just because they didn't give themselves priority. Either it was a child's exams, or it was husband's work, or it was mother not well, all sorts of things, excuses we have heard why they did not present. The most common thing that we used to hear was that because the lump was there, it was not giving me any trouble. It's only now, since the last few months, that it has increased, bleeding, all those things. So, but ignoring one's own symptoms is also still very rampant.
So, what is the youngest age at which you have actually treated a person with breast cancer?
At 19 years of age.
Okay.
A girl who was studying her BCom.
Oh, yes. So this is just for people to make aware that it is not necessary that people only after the age of 60 or 50 should get a breast cancer. As the age increases, obviously the risk increases, but it can start as early as even in 20s and 30s. It's always better to be aware of this, do physical self breast examination, and whenever in doubt, always take an opinion of a doctor, get a physical examination done. And many times the thing is, females are very for consult for a problem like breast, getting the right kind of doctor is also very important. Many people might not be comfortable going to a male doctor, so that is also one of the issues that many people face. So there are a lot of female surgeons and female oncologists actually in the city. So even if it is not female, that's okay, because the life is more precious than
yes,
this.
certainly.
So whenever in doubt, you can always go and get yourself tested. And don't be under the impression that if you get tested, it will come positive, because many times it is benign, and only in certain cases it can be actually cancerous. And as madam told, if it is detected very early, the chances that
Cure rates are very high.
Rates almost nearly 100% is what you need to remember. Yes, madam. And what is the role of genetic testing in terms of
so genetic testing is important, especially when it is a younger woman who has been diagnosed to have breast cancer. So that there has to be an index case, that either it is a very young woman who's diagnosed, or when we test for breast cancer, most of the times we test for 3 receptors: estrogen receptor, progesterone receptor, and HER2 receptor. If these 3 are negative, if these 3 are absent, we call it as triple negative breast cancers. So the genetically determined breast cancers, occur in young age people, and also many of them are triple negative. So triple negative, the breast cancers, we definitely check for genetics. A young woman having breast cancer, we definitely check for genetics. Genetics test is very simple. These genes are present since our birth. So it is only the blood test that has to be done, and a simple blood test, but of course it takes 2-3 weeks for the results to come. That will tell whether we are carrying any genes that predispose us to develop breast cancer. These genes which are responsible for breast cancer, maybe around 10 years back, 15 years back, we knew about only 2 to 4 genes. Now we know of 28 genes. And I'm sure science is evolution in progress, maybe in another 5-6 years, we may have 10 more genes added to the library or 20 more genes added to the library.
Yes, I think many people will know about this case of Angelina Jolie, where
Yes,
she got herself tested. So normally we call this BRCA genes, breast cancer genes. These are the top two, BRCA 1 and 2. But as Madam said, new genes are being detected. Basically, what these genes do is they affect with the repair of DNA. As Madam told, every cell has to divide. Parent cell will divide into two daughter cells. In the process of where the genetic code is getting copied, there are errors that can happen. As for example, we keep writing, we can do spelling mistakes in a writing. The similar thing happens in genetic code as well, because millions of bases have to be copied. And during this process, if there is any error that has happened, there is a mechanism by which the DNA gets repaired. Whatever is damaged, it is actually repaired, or if it is beyond repair, it is eliminated. So if for people who have this problem with these genes, we call it mutation, where the repair mechanism doesn't happen properly. So they are at increased risk of development of multiple cancers, mainly breast and ovary cancer. So with present day, there are a lot of tests. Even if you don't have any family history, there is because people in our community are people who generally were very health conscious. They want to get themselves tested and know. So there is these are tests that are available. These are blood tests. Might be a little expensive, not very expensive, but you'll at least get to know what is your risk. If suppose you are carrying a gene that increases the risk, say for example, a lifetime risk of a woman getting breast cancer at the age of probably 70 or 80 is about 12-13%. But a lifetime risk of somebody with a BRCA gene positive is almost 55 to 85%. So if somebody knows that they are a carrier of this gene, say for example, if anybody in your family has a early onset breast cancer, or they have got these tests done, and then probably what happens is your screening should start much early, not at the age of 40, probably before the age of 30. So this will tell you what is your risk. And obviously, just because this gene is positive, that doesn't make that they will definitely end up getting a cancer, but the risk increases, madam. So how will you approach somebody who comes with a BRCA positive, but for a preventive aspects, they've got this test done, there are no symptoms?
So there are two things. One is whatever is the gene present, what is the risk of development of breast cancer, ovarian cancers? What do we do to tackle that risk? So there is nothing like preventable thing. The gene is there. You just have to see that the gene is either not able to act. How do we do? By changing the environment in which the gene is proliferating in the cell. So that is where lifestyle matters. So even if a person is carrying that gene, a healthy lifestyle does modify the function of the gene, does not allow the gene to express itself as much, and reduces the risk. So even in people with BRCA mutation, a healthy lifestyle is extremely important. Second, yes, it will reduce the risk, but again, not really prevent it. So for BRCA mutated patients, there are something known as risk reducing surgeries. Risk reducing surgeries are there in which after the family is completed, the breasts may be operated, the ovaries and fallopian tubes may be operated. It reduces the risk of development of breast cancer and ovarian cancer, which is what Angelina Jolie did. She did bilateral breast removal. She did bilateral ovaries and fallopian tubes removal. Of course, but again, that is a little drastic measure. Not everybody would want to do that. So what is the other way out? We call them for blood for examination once in 6 months. every 6 months we do clinical examination, but also do some sort of imaging. So once we do a mammogram and ultrasound, 6 months later we'll do an MRI of the breast. Then 6 months later we'll do a mammogram and ultrasound. Then 6 months later we'll do an MRI of the breast. So every 6 months there is some kind of check on the breast.
Yes, ma'am. Yes, as madam told, actually we also tell in this program, like it is called seed and soil concept. Say, for example, you have a gene problem. That means the seed is already there. The seed will go into a tree only if you provide a fertile soil for that. So if your risk factor are more, so your diet is not good, you're not physically active, and your probably sleep is not good, your stress levels are more, then the chances that the seed will grow and become a tree is more. So if you focus on your lifestyle, you can reduce the risk. Obviously, you can't totally eliminate the risk of this thing. And one is lifestyle modification, and obviously frequent and early screening to detect if at all if it develops at a very early stage. And as madam told, there are people who also get this surgeries done. This surgery eliminates the risk by 90%. Does not totally makes yes. There is still an amount of risk even after the surgery, right, madam?
Yes, because we can't remove 100% of the breast tissue, we can't remove 100% of the ovarian tissue.
The risk reduces by 90%, but some risk still remains. So you can't think that you've got it removed and not focus on lifestyle. So that is also very important. Yes, madam, there are a few questions now coming in. So we'll just ask these questions. So one is, are there any injections one can take to avoid any type of cancer in the body, just as a precaution?
Unfortunately, no. And recently it had come in papers that there was a vaccine in Russia which was developed. And many people come to ask whether we are having that vaccine in India. So in case anybody here also has such a question, let me just answer to them that yes, Russia has published a study where vaccine was seen to prevent cancer, but not in human beings. It was in animal studies. They're yet to do human studies and yet to come out commercially with the vaccine. So like that, not just Russia, in many countries, these studies are going on.
And with regard to cervical cancer, definitely there is a vaccination where people, especially young females before actually marriage, can get this HPV vaccination where they can, that will reduce the risk of this thing. So with just regard to this topic, madam, if somebody is 40, 50, they still want to get this vaccine done for cervical cancer. So what is it basically?
So in the study, in the trial, the women up to 45 years were taken into the study. So we say if you are around 45, you can still take the vaccine. But if you are vaccinating children before the age of 18, only 2 doses are required. After that, you require 3 doses. So if I take 1 dose today, 1 dose after 6 to 8 weeks, the 3rd dose is after 6 months. So 3 dose schedule. As we grow old, younger children, only 2 doses are good enough.
Yes. So the next question is how to check for genetics. These tests are available in almost all major labs and hospitals.
Yes.
You can get this testing for cancerian general risk for cancer, specific organ specific cancer risk is also available. But there are a lot of tests where they test your genetics to see what is your this is called preventive genetic studies. There are a lot of tests are there. So probably next coming week or the 2 weeks from now, I'll have a session on how to look for genetics in terms of prevention of any kind of disease, including cancer. So this test is available. So we'll let you know where it is available. If somebody is interested, they can get this test done. So the next question is very interesting, madam. Early menstruation has become common now because as I was aware when I was small, the menstrual age at that time was 15 years. Now it has come to 10 years. So
even 9 and 8.
Yes, yeah. So less than 10. So how is it increasing the risk of breast cancer?
So once menstruation starts, it means ovaries have started producing estrogen. Now estrogen is a carcinogenic hormone for breast cancers. So early menstruation means and late menopause means that much duration of long estrogen exposure time is given to the breast.
Yes.
So that is how early menstruation and late menopause increases the risk of development of breast cancer because prolonged exposure to estrogen.
Yes. And there is a lot of research that is coming up because saying that the present lifestyle is actually the cause for early menarche in kids, exposure to a lot of junk food, too much of calories in
Yes.
diet, too much of sugar in diet, and not enough physical activity. And that is the reason why kids are actually attaining menarche at a very young age. And if you can do something for your kids, so if they can postpone the age of menarche, the total exposure of hormones during their lifetime is going to come down. That is one thing. And the other thing is early marriage. What is your this thing about early marriage? Now, people are having kids after 30. So how is it a
Yes.
risk?
So it is again this longer duration of exposure to estrogen.
Yes. And
Because during pregnancy, the ovaries are not functioning.
yes.
So you get that much protection.
Yes. So definitely pregnancy is a protection for breast cancer. And the second thing is breastfeeding. What is your this thing
So
about?
breastfeeding again for the same reason that because breastfeeding reduces the ovaries. Sometimes periods do not occur when the woman is lactating.
Yes.
So if periods are not occurring means ovaries are not producing estrogen. Ovaries are not producing estrogen means one cancer creating chemical is not being produced in the body.
Yes. Yes. So definitely there are many tools where you can try to assess your risk. It says that if the combined duration of breastfeeding is more than 2 years, say for example you have two kids and each one of them has breastfed for more than 1 year, so the combined duration is more than 2 years, that gives a protection. So any increase in breastfeeding actually gives a protection. So because earlier days kids used to breastfeed for 2-3 years, now they don't do for more than 6 months. So somebody is
Yes.
You are having your kids who are having children, make sure that they breastfeed
As
breastfeeding
long as possible.
as long as possible. It is beneficial not only for the child but also for the mother.
Yes. And also the breast is such an organ again that nature has made to make milk for the baby.
Yes.
So once the milk starts producing, the breast becomes more mature.
Yes.
Non-lactating breast remains a little immature compared to a lactating breast.
Yes, madam. So this immature cells have the chance of getting cancerous more as compared to mature breast cells.
Yes.
The purpose of, as madam said, the purpose of breast is to lactate. So if that purpose is taken away, obviously that is something evolutionary. If you think it is not right for the species, it might be right for that particular person. For the species, it is not a right thing to happen because you're not actually reproducing. So then probably nature has its own way of handling such things. So increase duration of breastfeeding is also very important. And how is oral contraceptive pills and hormone replacement therapy after menopause increasing the risk, madam?
So again, if estrogenic hormones are given, then they do increase the risk. It is the same logic there also. But now most of the pills do not contain estrogen. They contain some derivatives, but there is nothing that one can vouch as totally safe. So as much as one can avoid, better to do so. If it is medically necessary, understand that this is what is required for me and go ahead with all your screening and testing as regular schedule.
Yes. Yes. If possible, better to avoid all these kinds of oral contraceptive pills and other things. So, because it definitely increase the risk. So that is what madam is telling. And mm, is fibroadenoma of breast is a risk factor in the future if somebody has a fibroadenoma?
No, no. Fibroadenoma is never a risk factor. But the problem is that the woman starts thinking that every lump is a fibroadenoma.
Oh.
That one fibroadenoma is there. Another lump appears, they feel that this is also a fibroadenoma because I already have one. But that other one may not be a fibroadenoma.
Yes. Okay. And removal of ovaries and uterus have any effect on getting breast cancer? Say, for example, somebody's hysterectomy is done for some other reason, fibroid. Does it have any impact on?
Yes, yes, because estrogens are reduced. So that makes a person postmenopausal.
After menopause, I don't think it gives any. If it is removed after menopause.
The estrogen is not there from the ovary then. Some amount of estrogen is still produced in our body by the subcutaneous fat, by aromatization of the fats. Yes. That is why obesity is a risk.
Yes, actually, obesity increases the risk factor of breast cancer. As madam told, estrogen is the fats converts androgen to estrogen. So more fat, more estrogen is produced. There is increased inflammation, increased insulin resistance, and a lot of metabolic changes that happen with obesity, which increase the risk of not just breast cancer, but multiple cancers. So there are people who have reduced 20% of or more body weight in our program. Ma'am. There are a lot of people who have
Is
reduced a
it?
lot of
Oh,
weight in our program.
oh,
So people
okay.
can just type what is the amount of body weight reduction that you have done in the program. So at least madam will know. So
Very good.
people who have been with us for a very long time. So yes, they are putting 15%, 7 kgs in 45 days. So
Wow.
15%, 15%. So we do like all systematic, like I said, balanced diet. But we also, as an occasional means, use fasting as a tool to actually cleanse the body. Like I don't know, what is your opinion on that? Like for example, Ekadashi fasting. It's not a regular thing, but once in a while we do this regular fasting, sometimes extended duration fasting as a means to detoxify the body.
So I think I had put one slide of stress reduction in which there was something like acute stress and chronic stress. So suddenly, if I start doing fasting without any body preparation, without any physical preparation, mental preparation, that also kind of produces stress. So
Yes,
if
yes.
I have to do fasting, I have to have that much of willpower and all other things. I'm sure you people in living at 100 till 100 don't know much more than what I would tell you for
Yes, ma'am.
that. But intermittent fasting has been shown to be beneficial in some situations. But
Yes.
I don't know what you people have done in your program for all the women to reduce so much weight.
So we actually we do a holistic thing. So we cover all aspects of lifestyle. Don't depend on just one this thing. So
Okay.
fasting comes at a later stage when they change. It is only after 2 or 3 months in the program. So once we slowly change the diet, increase the duration of fasting, people are not. So we say not to snack. So the idea is you have to give rest to the GI system to heal itself, because we fundamentally believe the healing mechanisms are all inbuilt in the body. So we just have to give a chance for the body to heal itself. Otherwise, if you start interfering with the healing mechanism, it can't heal. So once they are prepared, then people slowly start doing Ekadashi fastings. We as it is, since we do in a group format, it becomes easy for people to this thing, and we
Yes, to
also
sustain that.
yes support this thing, and other things like increasing physical activity. There are people in our advanced batches who do up to 20, 30,000 steps a day. We focus on getting
My
at least
God.
7 to 8 hours of sleep.
Very good. Very
And
good.
so all these measures we do in a very scientific way. So it is a like group motivated kind of people.
Amazing.
And
Amazing.
when they get to hear information like this, madam, from you and from other this thing, they also get to know what is the science behind it, and it is easy to do. And we create an atmosphere which makes them like they want to do it. So because we give the reason why they have to do this.
So
So
it is a positive reinforcement.
yes, yes, madam. Yes. So there is no vaccination as of now for breast cancer. Future something might come up, and there are some questions. So Saroja madam says, I think she has this issue with like she was not able to breastfeed because milk was secretion was not there when she had children a long time back. So she was not able to breastfeed. So still there is an increased risk because there is no milk production.
So, see, some things are individual. Some women may lactate for 2 years, some may lactate only for 1 year. But if you have tried lactation and feeding baby, and if milk has not come, well, indeed, there may be a little increase in risk. But what does that increase in risk means? If at your age, supposing out of 100, 5 people were going to get breast cancer, because of not feeding, it may be 6. That's all. So to say that the risk increases numerically, but for an individual, it really doesn't matter.
Yes. So the other question is, does anything to do with tight clothes?
Clothing has got
No,
absolutely no
no.
effect.
And
No.
next is as PCOD and breast cancer. Is there any link?
So PCOD, again, it is irregular hormones. It definitely has got risk on uterus because how the hormones act on uterus, but not specifically for breast.
Breast cancer, yes. So I think we've taken quite a bit of questions. And with regard to treatment, I would like to ask, there is one more this thing, ma'am. Is there any blood test which is coming up in the future, or is already in the it is already available, where people can get this as a screening test. I know as of now there is no screening test in form of blood, this thing, but like for staging, and probably there's something called liquid biopsy. So
Yeah.
is something in the
So
pipeline?
liquid biopsy is not really for diagnosis. It is more for monitoring. What they do is in liquid biopsy, that what you are telling, liquid biopsy is just checking for the genes in the blood.
Yeah.
But I am not talking of that. I am talking of something known as the residual disease or the cancer burden in the body. So that they create a signature out of the cancer, the breast cancer which was there. They analyze the genes and create a genetic signature. Then they take your blood and try to match that signature. If that signature is present in the blood, it means somewhere in the body cancer is present. It cannot tell that cancer is where, but if the gene signature is present in the body, it tells that somewhere in the body there is presence of cancer. So there is a company in US, Natera Diagnostics, which is doing this. And same way, there is another company, Guardant, which Guardant Reveal, which will see if there are any malignant cells which are present in the blood. So it will tell you whether there are some cells in the blood. So they're more used for monitoring, looking at minimal residual disease rather than diagnosis. In India also, there are some labs which are doing these.
Yeah. But is there a chance that something will come up in the future? Because
sure.
That becomes much more easy than getting a mammogram and things
As
like
I
that.
said, science is ever evolving. It is work in progress.
Yes, something might come. Yes, definitely.
Yes, certainly.
Yes, madam. And hair dye, I don't think hair dye has anything to do with breast cancer. It has to do with the bladder cancer. We have covered this in a session. Hair dye has to do with the bladder cancer. But any exposure to chemical, for that matter, even plus plastics, pesticides, many of them are called endocrinal disruptors, where they disrupt the hormones, and they can certainly add to an existing thing. It is not that only a plastic is going to give you cancer, but if your lifestyle is already all messed up, then that can also add. So everything is, like we in medicine we say, this is multifactorial. So all these things, air pollution, plastics, pesticides, food additives, preservatives, all has a role to play. But provided if your other lifestyle factors are good, a small amount of exposure here and there might not be problematic, because
so all the puzzle pieces have to fit together.
Yes, yeah.
To start the process.
Yes. So if you do other things right, then probably you shouldn't worry about too much in this. So with respect to treatment, madam, what anything new that's coming up, or as
Yes. So now we have such individualized treatment. It's not just a one size fits all kind of treatment, which was said for chemotherapy. Now we have in early stage, in good risk disease, we don't use chemotherapies also. There are some things known as risk of recurrence scores. We send the tumor tissue for risk of recurrence score. If the risk of recurrence is very low, then we can avoid chemotherapy, use only hormone therapy. We have immunotherapies which are added to aggressive diseases. In HER2 new positive diseases, there are very good drugs which have come. Earlier, we used to be scared of HER2 positive diseases because they used to be very aggressive. But now when we see HER2 positive disease, we are happy because we have drugs for it. So many things have come up, And also the ways to monitor the disease, ways to pick up mutations, ways to give a drug targeted to a particular mutation. So all these things have come up, and metastatic breast cancer, stage 4 breast cancer also, patients may live for years together.
Yes. And can you just throw some light on immune therapy? So what is it, and how is it different from the routine chemotherapy? So that
Yes. So you would have heard a lot about immunotherapy. Immunotherapy has got a very small role to play in breast cancer, particularly. Only in triple negative breast cancers, immunotherapy has been used more. So what immunotherapy does, it is based on the premise that in our body, as you said, that our body has healing capabilities, and we just have to give the body opportunity to heal itself. It is thought that when there is a cancer developing in the body, it somehow makes our immune cells go to sleep. it does not allow them to act. It blocks their receptors. So it does not allow these housekeeping cells, or the T cells as we would name them, to go and circulate in the body, identify a cell which is a rogue cell or a foreign cell or a bad cell, and kill it. That is what normally happens in our body. But presence of cancer suppresses the function of these T cells by various mechanisms. Now, immunotherapy does that. Immunotherapy goes and stimulates these T cells by blocking various points on the tumor cell, on the T cell itself, and telling them, now get up, go. There is a cell somewhere which is dividing, not correct cell, go and kill that cell. So that is what then the T cells start getting activated, and they go around in the body, and whatever they find bad, they start killing. And there is also one thing that they can do. They can also cause autoimmune diseases, because sometimes they start fighting even our normal cells.
Yes.
So there may be side effect of autoimmune, hypothyroidism, or lung problems, pneumonitis, colitis. This can cause inflammation at other organs also, because they become so hyperactive.
Yes. Yes. So that's a new this thing that is coming up, especially for cancers where they are generally not amenable to regular kind of treatment, where the prognosis is bad and where it is already metastasized stage 4. Immunotherapy in selected cases, although it is not for every kind of this thing, but especially as you said, in the triple negative this thing, immunotherapy is really working for breast cancer. And you brought up this topic, so we normally keep discussing in this. Like I keep telling that you don't have to be afraid of cancer too much, because every day the body produces thousands of cancer cells, and the body has a mechanism to handle these cancer cells in the way of natural T killer cells, which identify these cancer cells and eliminate it. Like, say, for example, if there are a lot of cop thieves running around in the city, there are a lot of police. If the police number is higher, then you don't have to be worried. The cancer cells become cancerous only when the number of police decrease and the number of thieves increase. So we give this analogy saying that,
yeah, very well explained.
so if this happens, then the precancerous or cancer cells that are daily produced in each and every person, they get converted into a overt cancer. So focusing on all these lifestyles, early diagnosis, prevention will definitely help in prevention of cancer. And last couple of questions I'll ask, madam. What is the cost? Because obviously, generally, if somebody gets diagnosed with a breast cancer and with all the surgeries and multiple levels of chemotherapy, what is the average cost of?
So, see, the average cost of chemotherapies also depends on what stage we are diagnosing. If it is in an early stage, then the number of chemotherapies required are less, and the chemotherapy may be over on an average in 1.5 lakhs or 1 lakh rupees also. But as the stage becomes more, we require more number of modalities to treat, and there the cost keeps increasing. The anti-HER2 new therapy, though they are very good drugs, highly active drugs, they were very expensive, but now the cost is gradually coming down. Trastuzumab, which many years back used to cost 1.5 lakh rupees for one vial of 440 milligrams, now it costs some 30,000 rupees for that vial. So the cost is also coming down. But if you catch it in an early stage, not only the outcome is good, also the treatment that you require for cure is also less. The cost is also less. In metastatic disease, because we don't achieve a cure in stage 4, the treatment goes on as long as the person can tolerate it, as long as the disease continues to respond to it. So the cost also becomes sometimes infinite. We can't measure the cost totally then.
Yes. Yes, because many times India, the problem is 60 to 70% of people pay out of their pocket for all these medical expenses. So it is always better to get some insurance, and don't buy this insurance at 2 lakh, 3 lakh rupees. Short, at least at minimum of 10 lakh worth of insurance. If somebody, especially you are in the middle age.
I think whatever you can buy to the maximum, you should buy.
Yeah, so that if at all, touch wood, it should not happen. But in case if it is required, then at least the cost that is taken care of. Otherwise,
Yes.
the diagnosis itself is a horrific thing to have, and then trying to manage the financial part then adds to a lot of burden and other things. So the idea is to at least get a good health insurance
Coverage, yes.
coverage. Yes, if somebody doesn't have an insurance, please get a good health insurance and focus on prevention and early screening. Yes.
And now also the incentive is that the GST is not there.
Yes.
So what we were paying earlier, in some thousands, the premium has come down.
Yes. Yes, definitely, ma'am. Yes. So after this GST, I also bought a health insurance. GST was removed. I recently bought a health insurance
Yes.
for myself as well, for the family. So I had a different coverage, but
Yeah.
So this is another reason that you can think of buying a health insurance. Yes.
Yes.
Yes, madam. I think we have taken quite a bit of your time, and so there is a couple
Pleasure.
of
It was
questions
really a
like cooking
pleasure.
in air fry and micro. I don't think that is too much to worry about. I'll just handle them. So, so before we close, any final words to the people who have joined today?
Nothing, just be regular in examining yourself and giving time to yourself. Giving time to yourself is very important.
Yes. So, yes, madam, thank you. Thank you so much for your insights, especially with so much of experience. And so one, we can say that 60 to 70% of people in our community are females. So, so that again,
I hope it is useful for everyone.
Yes, yes. So,
because even if there are men,
yeah, obviously,
there are women in their lives.
Yes, yes. So
in
it is
any way, their mothers, wives,
Yes.
sisters, daughters, friends. So women are there.
Yes. And the other thing is, in program, since we do this lifestyle modification, it affects the entire family. It is not just the person who is
Yes.
joining the program.
Exactly.
The entire household gets changed in terms of what they eat, how they look health as. So the priority
asset.
itself, yeah,
Yes,
the priority
yes.
itself just it changes.
Yes.
So thank you, madam. Thank you so much. It's really a pleasure for
It was a
to
pleasure
have
for
you.
me also. Thank you all.
Thank you for your time.
Thank you.